Healthcare Informatics, Consumer Health Informatics, Chapter 13. For many years, your healthcare provider has relied on paper-based records to tell your health story. With the technology we have available today, this system has become antiquated, inefficient, and most of all, incomplete. Now, with electronic health records, healthcare providers have the ability to quickly share health information with one another, not only across the country, but across the world. This not only helps your doctor have a more complete picture of your health, but if the collection of this data is managed in a meaningful way, it has the potential to be translated into useful knowledge for the entire healthcare field. This is the emerging field of health informatics. Informatics is the study of collecting, organizing, storing, and using electronic information. The Health Information Technology for Economics in Clinical Health Act, or HITECH, was created as part of the American Recovery and Reinvestment Act, which was the economic stimulus bill in 2009. This HITECH Act was created to stimulate the adoption of electronic health records. Doctors were given monetary incentives to demonstrate meaningful use of the electronic health record by 2011. In 2015, they are now receiving penalties for not having done this. One of the requirements of meaningful use is that clinicians are supposed to provide patients with secure access to information in their electronic health record. A patient portal is a secure method of communication between a provider and his patient. With these incentives and penalties, you will see more and more providers convert to the electronic health record. This is done in an attempt to help patients engage in their own care. In any new field, it is important that standardized definitions are adopted so that ambiguity and uncertainty are lessened. However, this is still underway in the health informatics field and has a ways to go. This is an important step in making this information usable to the public. One example is the use of the acronym CHI, or CHI, which stands for Consumer Health Informatics. Many uses of this word are found in the literature of multiple organizations. It is imperative that consumers, clinicians, informaticians, and educators work together to formulate standard definitions in this field. Another area that may hinder the use of electronic health information by consumers is literacy skills. Health literacy is the ability to understand basic health information and services needed to make appropriate health decisions. It is important that a patient understands enough to question instructions. Visual literacy is the ability to understand graphs or other visual information, such as trend lines in lab results. Computational literacy is the ability to calculate or reason numerically, as in a body mass index. A patient also needs computer literacy so they can access any material that is available in an electronic format. Because of the necessity for the population to improve health literacy skills, the national government began an initiative known as Healthy People 2020. The terms digital native and digital immigrants have developed to describe those consumers who have grown up in a world of digital toys and tools and those who lived before the advent of these things, respectively. Members of both of these groups will be in the phases of their life where the majority of healthcare is used. Natives are the parents of young children, and immigrants are the elderly. The computer literacy of both groups will be different. In a telephone survey, 3,014 adults living in the U.S. were polled. Females, white adults, younger people, and those making $75,000 a year or more, and had those that had college or advanced degrees, were more likely to search for health information online. Latinos, African Americans, and those between the ages of 18 to 49 with some college education are more likely to use their phone to search the internet for health information. Mobile phones have bridged the digital divide between those that have access to broadband internet and those that only have access to dial-up service. The internet, therefore, seemed to be a good option when trying to disseminate health information, but access will be gained in different ways depending on the user. The availability of consumer health information, or CHI, has been dependent on the endlessly evolving information technology. There are self-help ebooks, online health articles and sites. There's online discussion boards, which include chats between patients with the same disease. There's automated appointment reminders that go out to parents to remind them that their children's vaccinations are due. Automated systems to learn about health conditions. Normally, doctors would have to schedule appointments to talk to patients about that. Now they can refer them to an online post about that. There are wearable sensors and monitors, such as glucose monitoring devices for patients with diabetes. And there's even some of the major medical schools even have online libraries and online librarians available to help you locate the most up-to-date medical data. The personal health record is a record maintained and updated by the individual himself. In the past, it's been paper, but it's an electronic tool that an individual can use to collect, track, and share information about past and current health issues for himself or a loved one. It's been promoted as a way to improve health care while lowering costs. Time will tell if this is the case, as widespread use of these have not occurred. Some of the problems are that physicians question the reliability of patient reported data and the legal issues related to depending on this data. To be effective, this information needs to be interoperative between healthcare systems, and this is not widespread yet. There are security issues as well, as to how this information could be used by patients to elicit prescriptions for narcotics and other ill-conceived ideas. All of these issues must be worked out. The PHR has the possibility to create a more balanced and complete view of the patient, especially when multiple physicians are involved or the patient is unable to care for himself. One major example of the use of PHR is the blue button. Patients of the Veterans Administration, Uniformed Services members, and Medicare patients can go to their patient portal and press a blue button that gives them access to all of their patient records within that agency. While this is not exactly a PHR as described earlier, because it only provides access to records from one agency, it does effectively expand access to healthcare records by patients. Validity and reliability of online health information continues to be a major concern of those that use this information. In 1995, Health on the Net, the acronym HON, H-O-N, was launched. It is an international non-governmental organization that developed a code of principles to evaluate what is on a website. Website certification is provided free of charge to requesting websites. This is one way to know that what you are reading on the web has been reviewed by a reliable source. Privacy and security are always an issue, but the privacy and security of any disclosed personal health information collected must be ensured. It is important to check that your online health information website has a hyperlink to its privacy statement and that you review it. With new innovations, new challenges for managing privacy and security issues will arise and ways of managing them will develop. Health information technology and consumer health informatics are definitely on the horizon. At times, it is a walk in the dark, but holds the potential for new and amazing developments in the healthcare field.